We are beginning to see the results with reduction of active cases by over 50% since last week.
Hope on the horizon for First Nations communities. After reaching record highs in January, the number of COVID cases on reserve is plummeting.
Right now, less than 2,000 active First Nations on reserve cases have been reported for the first time since early December.
Those significant improvements while Inuit communities hover at 15 active cases. Despite declines, news that Canada will be facing a shortfall in Moderna vaccines is reason for concern.
It's a bump in a road, short term.
The Moderna vaccine making more sense for remote and northern communities compared to Pfizer's because it doesn't require extremely cold temperatures to store and is easier to transport. Now the country is facing a 20% decline in this week's Moderna shipment, the second delay from the company this month.
It will affect a number of the elements that we have in terms of our planning, usually in the short term.
The minister is unable to say how many people the shortfall may impact. Meanwhile, Manitoba First Nations continue to be the hardest hit during the pandemic, despite Canada's vaccine rollout.
Yes, we're starting to see a decline, and that's because of a lot of restrictions that have been put in place in some of our most active communities.
Since the pandemic started, there have been 17,315 reported COVID cases on reserve. More than 64,000 doses of COVID vaccine administered to First Nations and Inuit. The minister not fazed by the shortfalls, sticking to deadlines.
But what we know for now is that our objective to get 75% of the northern remote communities fully vaccinated by the end of March is still on track.
Minister Miller also announcing upcoming legislation to give Indigenous peoples more control over the development and delivery of health services. In Ottawa, Nigel Newlove, City News.